Welcome back to TV5 News at 9. It is time now for Medical Moments with Covenant Healthcare. Joining us this morning is Medical Director Dr. Suzanne Bays. Thank you so much for being here, Dr. Bays. We appreciate it.
Good morning. Thanks for having me.
Of course. Good morning. This is one of the most important months out there. October National Breast Cancer Awareness Month is underway. And now Covenant has a few programs that we want to bring attention to at this time. Tell us more about those, Dr. Bays.
Good morning. Covenant Cancer Center is affiliated with the MD Anderson Cancer Program, and what that means is that in addition to following all the national guidelines in regard to cancer care, we at Covenant also follow the guidelines set forth by MD Anderson, which is the #1 cancer center in the country,
yes,
thus allowing us to take advantage of some of their state-of-the-art, cutting-edge approaches to multidisciplinary care of our cancer patients.
That's great. That's right here in our community. We love to hear about that. Now, tell us about the services that you offer patients at Covenant, Dr. Bays.
So this pertains to several different cancer sites, but because it's Breast Cancer Awareness Month, I will specifically point out some of the programs we have in breast cancer care. We have a very comprehensive breast cancer program, which means that we take care of the patient from actually before a cancer diagnosis, from screening, prevention, to diagnosis, treatment, and survivorship. What that means is that Covenant has specific programs designed to take care of the patients from the start up until getting them to be a survivor, so to speak,
sure,
and then throughout the rest of their lives. We have programs that are accredited by all the national organizations that are involved in the care of cancer patients, from the American College of Radiology to American College of Surgeons, American Society of Breast Surgeons, and of course the MD Anderson criteria. And what that means is that the patients will get the best in care as far as the medical knowledge, the expertise of their caregivers, but also they are guided throughout their journey by specialists in social work, in nurse navigation, in physical medicine and rehabilitation, so we can get them back to their pre-cancer functioning as close as possible.
Oh, that sounds comprehensive, and that's right in our backyard. Dr. Bays, you are a breast surgeon and you help treat the medical side of cancer, but we know it takes an emotional toll as well. So what support services can patients find at Covenant, Dr. Bays?
Absolutely. From the beginning, our nurse navigators, which are specialized nurses that take the patient throughout the process of let's say breast cancer care.
Sure.
They're there as a support person, somebody to pick up the phone and call. Of course, our office staff function in the same fashion. We also have specialized social workers who connect with the patients very early on, and again, they're there for emotional support. We have connections locally and regionally with mental health professionals. If somebody needs more support than what we have immediately available within the cancer center, we can reach out to many individuals in various mental health organizations that then will help our patients through.
And Dr. Bays, you know, I can just feel your passion and the love that you have for what you do. Why are you and your team so proud of the care that you provide?
We feel that we're a premier cancer care center here in the heart of mid-Michigan. Our patients really are cared for as family within the Covenant system, but we also offer them the same care that we want our own families to have. Our breast cancer patients really don't need to go outside our system to get the world-class care that they deserve to have. We can provide it right here in their hometowns, close to their homes, not only, of course, in Saginaw, but all of our surrounding communities.
Sure, and Dr. Bays, we all know that with breast cancer, that early detection is key. Is there anything else that you would like to cover that we haven't covered that you want people to know out there about Covenant and your services?
I think it's really important to emphasize that breast cancer screening with mammography and a visit to your primary care provider once a year is very important. We recommend screening mammography starting at age 40 and then continuing it once a year for as long as the patient's health allows them to do that. Otherwise, just be aware of any changes in your own body. If you notice that there is a new lump, the skin looks different, there's a new discharge, any other changes in symptoms as far as pain, or if there is a finding that you just don't understand, we're always available to help patients through any questions they may have.
Well, you have put our minds at ease. Thank you. Medical Director Dr. Suzanne Bays, we are so appreciative that you stopped in today to give us this information during Breast Cancer Awareness Month. Thank you so much for your time.
Thank you so much for having me.
You're welcome, Dr. Bays. If you'd like any additional information on this topic, please just head on over to the Hot Links page on WNEM.com.